We presented an update on the OPTiM study, which was a randomized phase 3 study in which patients with unresectable stage 3B, 3C, and stage 4 melanoma received intralesional T-VEC versus GM-CSF given subcutaneously. Specifically, what we focused on yesterday was really looking at the earlier stage patients. These are the patients that have stage 3B, 3C, and stage 4 M1A disease. And we were interested in looking at the response patterns in those patients. And what we found was that, first of all, the response in those group of patients who were treated with T-VEC was over 40%. And many of these patients had complete responses. We also were interested in looking specifically at the durable response in these patients. And we found that 25% of patients treated with T-VEC had a durable response. And the way we defined this was patients who had a response that lasted 6 months or longer. So then we dove a little bit more into the data, and we were interested in determining how those responses occurred. Specifically, we know with immunotherapies, often patients can have progression of their disease before they respond. They can also have new lesions that develop before they respond. So we looked at those response patterns. And we found that of the patients that were treated with T-VEC that had a durable response, half of those patients actually had progression prior to responding. The majority of those patients who progressed prior to responding had new lesions that developed. We also found, interestingly, from this study that in the group of patients who had no progression prior to responding, the median time to response was 3.1 months, whereas in the patients who had progression prior to responding, the median time was 5.1 months, so 2 months longer. But whether the patient progressed or did not progress prior to responding really did not have an impact on the overall survival and the duration of the response. And actually in this study, over 80% of the patients are still responding, so the median duration of the response has not yet been met. So I think really the take-home message from this is that when we treat patients with T-VEC, even if they progress during the initiation of the treatment, we should continue treating them with T-VEC as long as that progression is not clinically significant.